All right, we are back, and now we have Lori Brotto with us. I am so excited. Thank you for being on today.
My absolute pleasure, Erin. Great to be here.
Awesome, awesome. Yes. So I'm going to read your incredible bio. Dr. Lori Brotto is internationally recognized as a leader in sexual health research. She has mentored 149 trainees and evaluated psychological interventions for sexual dysfunction and genital pain, which collectively impact one-third of women. Her work influences practice internationally with mindfulness now implemented in sexual medicine centers and recommended as a frontline care in international guidelines. In recognition of her contribution, she holds a Canadian Research Chair in Women's Sexual Health. She has received recent awards in mentoring junior faculty, excellent public education through media, book awards, and is listed among the 2% cited scientists. 2% cited scientists by Stanford and Elsevier. And you've just won Women of the Year with BC Business. Like, holy smokes. You need to work harder. You need to
Honor.
like really work for some stuff, really. I mean, come on.
Yeah. Well, easy to do when it's all in the name of women's health.
There you go. I love that. And I really appreciate you coming on today. Sexual health is so important. I think especially
Yeah.
women as we kind of hit that midlife. It's something I hear a lot when I'm talking to women is, the fact that they don't have a libido or they're just
Mhm.
like all of a sudden things have changed and their bodies have changed, which also can
Yeah.
impact that as well and how they feel sexual.
Completely.
Right. And so many women experience this change in sexual health during menopause,
Yeah.
decreased libido, and as you've just said here with your research that you're doing as well, discomfort. So, what are some practical
Yeah.
strategies or treatments that you can recommend for women to maintain a fulfilling sexual like sex life,
Yeah.
sexyful sex life during this transition? Whatever, just all the good
Keep it
sex.
sexy.
Keep it
Yeah.
sexy. I love it.
Yeah. I mean, awesome. I'm so glad we're having this conversation because there's still so many myths and taboos that float around in society about when you hit menopause, it's all over.
Mhm.
And, again, there's a myth that's been floating around for a long time that women hit their sexual peak at 36 and then it's all downhill. That's actually not true. That statistic was taken from the 1950s work of Alfred Kinsey, who found that 36-year-olds had the most frequent orgasms. Has nothing to do with desire
Really?
or pleasure or anything like that. And it's because at that age, at least back in the 1950s, women's kids were already teenagers. They were having that sense of,
Mm.
time and freedom, et cetera, et cetera. So, I mean, first of all, I think it's really important to prioritize conversations about sex. And that means
Mhm.
conversations with your healthcare provider, recognizing that a lot of healthcare providers are just not trained in sexual health. Even to this day, UBC Medical School, where I'm at, they get maybe 4 hours in all of 4 years of medical school on sexual health, which is not enough to really understand the complexity of sexual health and the various genders and how it changes over time. So, being able to have open dialogue and conversation with your healthcare provider, open dialogue and conversation with your partner, if you have a partner,
Yeah.
and that means, not only telling a partner what feels good and what you want your partner to do or not do, but also when it hurts. And
Mhm.
certainly in midlife, we see an increase in vaginal dryness as a direct result of the drop in estrogen. And so the frequency of genital urinary symptoms, including pain with sex, is pretty high. And so being able to, pivot if vaginal penetration is not possible, to pivot to other activities.
Mhm.
And then having kind of an open dialogue and conversation with yourself, remembering that sexual
Yeah.
health is health. It's part of quality of life.
Mhm.
It's part of how we
Yeah.
define ourselves. So I think that's, I think the first piece of advice is let's talk about this more often.
Yeah, I 100% agree. And I think also just giving permission to be sexual. I think that's something, especially as women, especially maybe midlife and depending on, your background growing up, but to give yourself permission to allow yourself to be a sexual being. And that is a good thing. It's nothing to be ashamed of or
Yeah.
to be, you might not want to yell it to all your workmates, but I mean, and if you want to, then all, but
I've been
hey,
known to hand
you
out
know.
lubricants to my workmates and at dinner parties. So just saying.
You might be, well, mind you, I could probably get away with it. I could hand out lady
Yeah.
bits and people would be like, thank you, right? So I
Yeah.
guess I could too. So when we look at, the challenging times that we can have, I mean, relationships are challenging no matter what,
Yeah.
right? I mean,
Yeah.
having a sustainable long-term relationship is a lot of work.
Yeah.
And especially with intimate relationships as well. And so how can women and their partners navigate these changes together?
Yeah.
Because I think, one of the things when we brought the M factor and you were an incredible like force on that stage talking about sexual health and menopause. But one of the things when we look at that is there were some partners who were there that for the first time began to understand what menopause was.
Yeah.
And they
Yeah.
were just like dumbfounded. One of my girlfriends told me her husband came with her, and afterwards he looked at her and said, I am so sorry. I
Oh,
thought you were overreacting all this time. He goes, I
oh,
had no clue. Right. So this understanding of
yeah.
this. And I think when partners are kind of in the dark about what's happening, which is one of the reasons why we need to have tons of these
Yeah.
conversations going on, but especially when you're talking about sexual health. So not only do you have all these changes going on and you're feeling like the highs and lows of your hormones,
Yeah.
but then you're trying to explain this to your partner who might not be able to understand that. So how
Yeah.
can we like, what are some things people can do to open up that conversation and to have with
Yeah.
their partner?
Yeah, I mean, you said it so well there, Erin, and that is, the communication piece of it. And so,
Mm-hmm.
bring a partner to events and webinars
Yeah.
and sharing, listening to podcasts together. Go to a sex therapy session together with your partner. Sex therapy can be an amazing place, even just to get basic education about sexual health. It doesn't have to be years and years of therapy where you uncover childhood traumas and you process all of the terrible things that have happened to leave you with a sexual concern. Can be an amazing place to get accurate evidence-based information about sexual health in a
Yeah.
non-judgmental atmosphere. So I really want to advocate for, sex therapists. And, in Canada, we've got lots. In British Columbia in particular, we have quite a few who are extremely well trained. And yeah, so I think the perspective of the person in the M Factor audience of, having their partner express empathy, which
Mm-hmm.
is, I get it now. I can't
Mm-hmm.
firsthand experience what you've gone through, but I can imagine what you've gone through, and I'm sorry, or I feel for you, or what can I do to contribute?
Yeah.
I mean, empathy is one of the really key parts of desire in a long-term relationship, right? When you
Yes.
feel heard
Safe.
and
When you
connected
feel
to,
safe. Yeah.
and safe and vulnerable, that's a really important pathway to desire,
Right.
especially in a long-term relationship where, the reward centers that respond to novelty are not firing anymore,
Yeah.
right? If you're
Right.
staring at someone in the face that you've been staring at for 3 decades, the
Yeah.
reward value is just not there anymore. And so we
Mm-hmm.
really rely on other cues. But a lot of midlife women say, wow, for the first time with, kids out of the house and finally financial stability or a sense of confidence, I'm actually discovering desire for the first time. I'm actually having a bit
Mm.
more time to focus on what is arousing to me. And so that
Yeah.
would be, I think, another piece of advice for listeners who are in a relationship is, take a chance and do something new. Buy a
Mm-hmm.
vibrator, explore a different
Yeah.
position, get a great lubricant,
Mm-hmm.
watch some tasteful erotica together,
Yeah.
share a fantasy. And if it doesn't work out well, fine, you have absolutely
Yeah.
nothing to lose.
True.
But again, in that long-term relationship, it's really important to kind of do some things that are a little bit novel to make the desire, triggered a bit more often.
That's really good advice. And I want to kind of swing to your book. Now, before I mention your book, I actually want to, I love this in your bio because I didn't read your long bio because your bio is so incredible. But I love this fact. So, if everybody did not know this, in 2018, your book appeared in the New York Times top 8 sexual health books. Is that correct?
Yeah,
And it was in 2024 as well?
yeah,
Did it kind of, that is
yeah,
incredible.
yeah.
Look at you, New York Times bestseller person. So, so in your books that you've
Oh,
written, so if
yeah,
you want a good read, here's you can also get some good reads from Lori as well. Your book emphasizes the role of mindfulness in improving sexual well-being, and I know with cognitive behavioral therapy, there's a lot of use that now with menopause as well. So
yeah,
you're obviously
yeah.
using mindfulness in connection to thought and paying
Hmm.
attention to the thoughts you think. That's one of our
Yeah,
first pillars in the brand, and
yeah,
how mindfulness can help women navigate the physical and emotional changes that come with menopause, and how
yeah.
I mean, how does that work in
How do
that
you do
sense? You're
that
just
exactly?
how do
Yeah.
you do that?
Yeah.
Tell us.
Yeah. And a lot of women or even patients will say, so you're telling me that paying attention to thoughts is going to improve my arousal and desire and
Yeah.
make me orgasm better? And the answer is yes. And as a researcher, someone who's been a professor at UBC for over 20 years now, this is something we've studied very, very extensively. So, one of the really important things to recognize is that our thoughts in our mind impact our physiology in our body. And I know you know that extremely well,
Hmm.
Erin, that it's all connected. Our thoughts
Hmm.
don't just stay isolated in our brain.
Yeah.
Every thought we have has a physiological manifestation in the body
Hmm.
and vice versa. So, as
Yeah.
an example, if we have an increase in heart rate because because of, something that is fearful in front of us, we're going to experience fear in our mind, and we're going to have
Yeah.
thoughts, oh my gosh, am I safe? So
Hmm.
there's a bi-directional relationship between the brain and the body. And that suggests that changing thoughts, or even having a different relationship with thoughts, is one very effective way of changing our physiology.
Hmm.
And this phenomenon has been tested so many different ways in women with sexual problems, women without. I've done a lot of work with cancer survivors after surgery. Yes,
Yes.
even after surgery, we can restore physiological sexual function through brain mechanisms.
Hmm.
And it's a really, really powerful phenomenon. So that's kind of the more cognitive behavioral route, where we're confronting negative thoughts and challenging them and changing them. And then there's the mindfulness approach, which is, just treat thoughts as something your brain does, right? Don't
Hmm.
even treat them as facts. Don't even treat them as something you need to listen to and follow. In the same way that the skin produces 50 billion skin cells a day, the brain produces these random thoughts, and you don't have to listen to them and pay attention to them. And so the
Hmm.
mindful approach to dealing with thoughts is one where you kind of get a bit of a detached stance away from problematic thoughts, and you just see them as something the brain does. And as soon as you do that, they bother you less. And
Yeah.
in
Well,
turn,
you don't have the
yeah,
attachment to as much, right?
you got it.
And
That's
let go of that
exactly the
attachment
term.
to it.
Yeah, you let go
Wow.
of the attachment.
And
So,
so, what's the name of your book that would actually, if you would suggest somebody wants to really look
yeah.
into this? What's
So
the title of your book again?
anyone who wants to really understand kind of the
Yeah.
science of this, but it's written in a
Yeah.
really accessible way, that's Better Sex
Okay.
Through Mindfulness.
Okay.
And then anyone who wants the practical how to, like, hold my hand and walk me through the exercises,
Yeah.
that's the workbook, the Better Sex Through
Nice.
Mindfulness workbook.
Okay.
And I'm just working on another book right now, which is really focused on myths about women's sexual health, with a heavy
Love that.
emphasis on midlife. And so
So
it's
are
in the
your books
works.
available on Amazon as well too?
Yeah, those two
Well,
are
there you
available on
go. Today you
Amazon.
can
Yeah.
get my workbook and Lori's
Yeah,
workbook, and you'll
all
be
in one
like set.
bundle. Let's bundle them.
Bundle them exactly. So, last couple questions because I know you were so busy. Menopause is often surrounded by stigma and misinformation, and I know you spend a lot of time educating women and telling them the way it actually is. What steps can healthcare providers and society take to normalize these conversations about menopause and really empower women in this stage of their lives?
Yeah, so our healthcare providers need to catch up, and
Yeah,
my heart and my empathy goes to them, because it's a really challenging healthcare system that we work in, where patients are seen on average for 8 minutes, and so there's not a lot of time to address a lot of health issues, including menopause. But even when
hmm,
women do muster up the courage to bring it up, a lot of healthcare providers are still kind of based in old models of
yeah,
misinformation and haven't received good menopause education. Our team at the Women's Health Research Institute last year published a big report called the Her BC study, based on 2,000 BC-based women on their experiences with menopause, where they sought treatment. And as a result of that, the UBC Medical School is now teaching menopause education to
Oh,
medical
that's
students as a
amazing.
result of that study. So
That
that's
is
what we need more of.
amazing.
That's what we need
Yeah.
more of. So we need our healthcare providers, if they haven't had the training, to actually go out of their way to get the additional training. And because we finally are having a conversation about menopause, it's not that hard to
Yeah.
get menopause related education through the Canadian Menopause Society, through
Yes.
the Menopause Society, which is the
Yeah.
American version, and then lots of webinars and continuing medical education events. And, that's with a focus on physicians, but all of the allied healthcare providers. I do a lot of
Yeah.
training of psychologists as well, and let people know, menopause management is not just in the domain of primary care. We all
Yeah.
play a role as healthcare providers. So
Yeah.
that's my hope, is that all healthcare providers will take on the training and then feel really competent to be able to care better for women.
Well, you definitely are doing that and way more. I know you're constantly doing research, right? So if
Hmm.
people want to follow you, because I know sometimes I see on your stories, you'll be
Yeah,
kind of saying, hey, if this is something that appeals to, or is this something you're going through? We're really
yeah,
looking for people to come in and share their stories. So where
yeah,
can people follow you to kind of stay abreast? Because are you looking for
yeah.
some people right now for
We sure
something?
are. Yeah, we've got
Yeah.
about a
Okay.
dozen studies underway.
Okay.
So my Instagram page is at Dr. Lori Brotto.
Yeah.
My research Instagram handle is at UBCSHR. So that stands
Okay.
for University of British Columbia Sexual Health
Okay.
Research. And we are constantly posting for studies that we're recruiting for. It's an opportunity also for women who have sexual problems, well, women and people of other genders too, to
Hmm.
get free treatment
Yeah.
in exchange for contributing,
Amazing.
questionnaires and whatnot. So yeah, so UBCSHR.
Okay. Well, thank you so much for taking time to be with me today and with everybody as well. I suggest everybody follow Lori. She is incredible. And take a look at her research. And if something on that research page appeals to you or calls out to you and is like, oh my gosh, that's something I'm kind of dealing with, I think it's a
Mhm.
wonderful way to not only support others, but then also in turn get some support yourself if you're looking for that. So thank you
Awesome.
for being with
Thank
me today.
you.
Okay, thanks so
Thank
much.
you.
Okay, stay tuned, everybody. We've got more coming.